Time. Time drives us to choose what to see, where to go, or what to do. After all, our most important choice is how we spend our lifetime. With technology, humanity has created time. We have reinvented multitasking. We can perform century-old tasks faster. We can do so much more with less effort. Sadly, this is not true for healthcare. Medicine is all about freeing people from the limits of diseases, allowing them to realize their purpose and spend time with the ones they love. So it should also ensure health professionals achieve their purpose, work impactfully, and live with quality. Well, we believe it's time to bring productivity-enhancing, outcome-improving progress to healthcare. We are proud to present the most advanced clinical decision support system with care automation. UpHill combines a decision support system based on the best evidence available, paired with patient communication and tasking automation.
Hi, Mr. Williams. I am calling from your hospital, and I want to help control some signs and symptoms related to your heart.
Mr. Williams is 74 years old, and he has been living with heart failure for a decade. Health teams try to keep track of his progress, but there was no clear understanding on what should be done next to improve his health. With UpHill, Mr. Williams is positioned in a predefined clinical journey. Past, present, and future needs are clearly identified. Clinical data is centralized and shared across multiple departments, and all teams can easily understand his precise status in real time. So, if he's ever admitted to the hospital again, anyone can quickly understand the main thread of his clinical evolution.
Now I want you to think about how you have been feeling in the last week. Do your ankles or legs feel more swollen than usual?
Yes.
After discharge, Mr. Williams is in contact with the hospital by answering simple periodic questions about his symptoms. There is no need for expensive or cumbersome devices. He just needs his phone. All your patients can be followed up comfortably and can be given immediate feedback on their health status, ensuring higher adherence to the clinical plan.
Mr. Williams, your symptoms seem to have changed in the last few days. I have informed your health team. In the meantime, let's try to follow the plan agreed with Dr. Jane. I have just sent you a message with all the details.
Simultaneously, based on the collected data, Mr. Williams' status is intelligently updated. The next best action is always suggested and can be immediately automated. For example, an appointment will be automatically scheduled to assess his needs. Like Mr. Williams, there are more than 60 million patients with heart failure. More importantly, 1 out of 3 adults will eventually suffer from chronic diseases, and many others will interact with healthcare due to other conditions. Think about how patient tracking can improve care coordination, how automated follow-ups can prevent hospitalizations, how better patient stratification can avoid unnecessary appointments, how automation of repetitive tasks can save you time. We are really sure your teams will appreciate it, and your patients will too. Because it's all about saving time. The time health teams need to focus on patients that really need their attention, the time patients wait to receive care, and the time available to increase your hospital capacity. So it's up to you to make the best use of time by giving doctors more time to focus on their purpose, and patients more time to be with their loved ones.